Colombia still missing. The negotiations in the CAO continue, but the ambassador of Colombia will join us whenever they are finished in the other room. We are pleased to come together today to the launch of the new report of the Global Commission for Drug Policy, which is called Beyond Punishment: From Criminal Justice Responses to Drug Policy Reform. First of all, I'd like to thank the Global Commission on Drug Policy, particularly Commissioner Dr. Geoff Gallup, sitting next to me, for organizing this event with us. My thanks also go to the co-sponsors of this event. This is North Macedonia, Serbia, Brazil, the Czech Republic, Slovenia, Colombia, South Africa, and Malta. I commend the Global Commission for their report. It sheds a critical light on the negative impacts of punitive drugs policies and practices, from mass incarceration, grave human rights violations, or the use of death penalty, while also providing concrete examples of the benefits that can be reaped by pursuing an alternative approach, characterized by scientific evidence, public health, and human rights. This is where our Swiss innovative four pillars policy was rolled out, led by our former president, Ruud Dreyfus, who also is a member of the Global Commission. The four pillars include prevention, treatment, harm reduction, and last but not least, law enforcement. This balanced approach has been highly successful. HIV rates decreased, while a robust offering of treatment options, including different options for opioid agonist therapy, have made a difference for many people who use drugs. Swiss drug policy has evolved steadily over time. For example, the first drug consumption room was opened in Bern in 1986. Until today, such centers have a meaningful impact on urban society and public safety, bringing drug use indoors, while providing a vital pathway for connecting vulnerable and marginalized individuals with life-saving health and social services. Drug checking services that are available in many Swiss cities do not only provide a harm reduction intervention for direct service users, but also have been a key resource of early warning data. Just as an example, Harm Reduction International's Global State of Harm Reduction 2024 notes that the drug checking service in Zurich was instrumental in detecting synthetic cannabinoid receptor agonists in herbal cannabis in the city of Zurich. To conclude with, let me again congratulate the Global Commission on their report and on the continuing to play an important role by addressing issues that would otherwise be neglected. We look forward to hearing more details about the report and about the insights from our panelists. We encourage everyone to take a closer look at the report. It's definitely worth reading. I thank you, and I pass the floor to Commissioner Geoff Gallup.
Thank you very much. Is that coming through okay? Firstly, can I thank all of those that have been involved in this event for your invitation to the Global Commission to attend. It's the first time that we've come to this particular activity since our formation back in 2011, and we do appreciate the opportunity to present our views to you. The Global Commission was created, as I indicated, back in 2011, and the idea was that we bring together politicians, senior policymakers within government, in all spheres of life, political, economic, and cultural, to make the case that the war on drugs has failed and we need to move to a new set of initiatives. We recommend drug policy reform mainly by means of 5 pathways. 1, to put people's health and safety first. 2, to ensure access to essential medicines and pain control. 3, to end the criminalisation and incarceration of people who use drugs. 4, to refocus enforcement responses to drug trafficking and organised crime. And finally, to regulate drug markets so that the governments are in control. We've developed this particular set of themes around the idea that the war on drugs and the prohibitionism that feeds it wastes money and wrecks lives. Wastes money and wrecks lives. And these are the two amongst other issues that we put on the table for consideration by our public policy makers. To that end, we've published many reports. The one that is being launched here today, Beyond Punishment from Criminal Justice Responses to Drug Policy Reform. We think it's an important contribution to a debate that we need to have in terms of those who suffer as a result of their use and abuse, perhaps, of drugs, and for those who need more information about the whole issue. We point out that attempts to control or eliminate the drug trade have fueled increased violence, toxic drug suppliers, and crises in criminal justice systems. The report goes further and says that prohibition has undermined and damaged public health, human rights, and the rule of law. While those who control and profit from illegal markets are responsible for violence, exploitation, and undermining state security, it is the most vulnerable individuals who feel the full brunt of the criminal justice system. Those without control, those who are exploited, those with the least power. It's not surprising, although a long time coming, that the drug control conventions in 1961, 1971, and 1988 are now the subject of wide-ranging criticism from both medical scientists and social researchers. But that's a story for another day. What we are seeing now, I think, is a bringing together, indeed bringing together something that should have happened, I think, earlier in our debates on this issue, bringing together all of the issues that relate to illicit drug use, rather than have rights, health, and security factors being considered separately along a different railway line, to have them unified in discussion and analysis. Currently, estimates show that about 292 million people use narcotic drugs. They do so for a wide range of reasons, and not all amongst them experience difficulties. UNODC estimates that about 10 to 14% of users experience forms of dependency. It's not a new problem, this, of course, or not a new issue, perhaps I should say. It's been happening for millennia. Research in Spain indicates that people were getting high on hallucinogenic drugs around 3,000 years ago. What has been subject to change are the drugs themselves, and today they can be seriously potent. In our report, we point to the over 1 million of people who have died from overdose in the last 2 decades in North America. Synthetic opioids are the main part of the picture. Drug checking has become a matter of life and death. I was pleased to hear the ambassador mention the role that now plays in the Swiss approach to policy. Despite our conventions, despite our criminalisation, and despite our policing, the problems persist. As the report put it, the triggers for drug dependency are multifaceted, often including responses to trauma, adverse child experiences, homelessness, and self-medication for health conditions, or neurodiversity. Responding to these experiences by criminalising people is disproportionate and counterproductive. Rather than addressing the underlying issues that contribute to dependency, criminalisation often exacerbates them, with punitive measures leading to further marginalisation, making it harder for individuals to access support. It is the concerns about the treatment ethics involved and the overall effectiveness that has led to the case for decriminalisation of drug use and possession for use, and for legal regulation of supply. The Global Commission recommends 2 pathways as part of the 5 pathways that deal with these issues. We recommend that states stop criminalising people for drug use and possession and rely on alternatives to incarceration for non-violent, low-level participants in illicit drug markets, such as small farmers, couriers, and others involved in the production, transport, and sale of illicit drugs. The most effective way to reduce the extensive harms of the drug prohibition regime and to advance the goals of public health and safety is ultimately to bring drugs under control through responsible legal regulation. Therefore, states must consider the legal regulation of drugs as the responsible pathway to undermine organised crime, which can liberate resources to counter its root causes, as well as mitigate any anticipated changes in organised crime activity. Prohibitive, punitive, and criminalising policies also ensure high-risk behaviours, such as unsafe injecting, while deterring people in need of drug treatment from seeking it, from fear of the stigma attached. Now, we have seen a very interesting and important change in our society in recent years, and that has been the development of harm reduction. Needle exchange programs, for example, have been a highly effective harm reduction response. Add to that overdose prevention centres, drug checking, which we mentioned, safer supply models, take-home naloxone, opioid agonist therapy. Put all that together in a package and we're doing better now than we ever did in the past. And we reached that bottom of the road, the intersection, which has on the other side the criminalisation through the conventions, and we have opposition within some parts of our society to any of these issues. Another important part of our report is to focus on the need for equality considerations. This is a report that tries to bring in the range of issues and put them together: health, freedom, and also security. But it's not just it's also a question of the redistribution and distribution aspects of power and status. While drug use is widespread across all socio-economic backgrounds, those living in deprivation, particularly racial and ethnic minority groups and young people from these communities, are disproportionately criminalised for drug offences. Inequality is also a driver of drug dependency and increases the likelihood of economically disadvantaged individuals becoming involved in the illegal market as low-level actors. Once in these low-level positions, they face greater exposure to law enforcement and are more likely to be criminalised. Meanwhile, individuals with more resources can evade arrest or secure qualified legal representation. And the report has many statistics from different jurisdictions about how those inequalities work, and particularly in relation to racial minorities. Let me now conclude my remarks by saying that we need to incorporate the social and economic factors at play in the cycle of exclusion. We see it all around us in the United Nations, the sustainability principles, which are a very useful guide for good government. Policies of inclusion and programs for harm reduction all matter, but so do to integrated social and legal support services. Again, we need the UN position on SDGs to come into the major decision-making processes and not treated as a separate item. So that leads me to my final remarks. As the High Commissioner for Human Rights put it so well only recently in Brandenburg, we must continue pursuing humane drug policies that advance all human rights. There is a real human rights issue here when we look at our practices, the ideas that underpin those practices, and the failure to look at what the evidence tells us about all of those factors. My final comment comes from the late Pope, who wrote extensively on the marginalised people. He said of the challenge of compassion, it takes us to concrete action, and the reinstatement of the marginalized. The reinstatement of the marginalized. Very powerful language. Truly, he said of his own faith, which may not be shared by everyone, and indeed isn't, it's one faith amongst others. He said of his faith that the gospel of the marginalized is where our credibility is at stake, is discovered and revealed. The same could be said about all of us. Our credibility is at stake in doing things that we now know don't achieve their purpose and just make matters worse. So I commend you to read our report. And once again, thank you very much for giving me the opportunity to talk about the Global Commission response to drug policy. Thank you very much. I'd now like to ask Faribas Soltani, the Chief of the HIV AIDS Section and Global AIDS, to make some comments. Thank you. Thank you.
Good afternoon, Excellencies, colleagues, partners, ladies and gentlemen. Thank you for giving us this opportunity to also be a part of this discussion, very important discussion, and to present the work that we have been doing in UNODC for the past 25 years in addressing HIV, hepatitis, and addressing harm reduction within the work that we are doing at country level and also at global level. So let me begin by thanking the government of Switzerland and the Global Commission on Drug Policy for convening this timely event and for the launch of this important report. The drug policy, the report speaks directly to the challenges we face across justice and health systems. And it reflects what we see every day in our work, especially in the context of drugs, drug use, prisons, law enforcement, and HIV and hepatitis, which we are addressing. Across many countries, criminal justice responses to drug use remains rooted in punitive measures rather than care. While we really know what works, and we've had the interventions on addressing the drug use in a public health-based and in a health-related measures, on especially for addressing HIV and hepatitis and also for providing drug dependence treatment. From policing to sentencing policies and prison conditions, people who use drugs continue to be disproportionately targeted, detained, and marginalized. The result is not greater safety, but deeper cycles of harm, huge burden on the criminal justice system, overcrowded prisons, entrenched stigma, and missed opportunities for addressing the underlying issues through a public health-based approach. Prisons are particularly emblematic of these challenges. Today, over 11.5 million people are incarcerated worldwide, and more than 1/3 are held in pre-trial detention centers. A significant proportion of these individuals are incarcerated for drug-related offenses, often minor, non-violent ones. According to UNODC World Drug Report, 2.2 million people are in prison for drug-related offenses, and of these, roughly 1 in 5 are held solely for possession for personal use. Do they need to be in prison? I don't think so. We also know that people in prison are significantly more likely to be living with HIV, hepatitis, tuberculosis than the general population. According to the latest data, 1.3% of people in prisons are living with HIV, 15.1% are living with hepatitis C, and 2.8% have active tuberculosis. These figures are not abstract. They are not just figures. They represent individuals who are exposed to serious, often preventable health risks. And really, it's not necessary to expose them to these health risks. Structural conditions in prisons, the overcrowding, stigma, lack of continuity of care, and separation of prison health systems from national health services exacerbate the risks of infectious disease transmission. These risks are compounded by widespread unprotected sex, unsafe injecting practices, and gender-based violence. The failure to address the health needs of people in prisons, especially those living with or at risk of HIV, hepatitis, and TB, is not only a prison health issue, it is a public health issue. In response, UNODC, we have been supporting countries to address these gaps through technical assistance, policy guidance, and capacity building. We work to scale up evidence-informed, right-based responses to HIV and health issues in closed settings, as well as working, of course, on HIV harm reduction. A key part of this is promoting the comprehensive package of interventions for HIV prevention, treatment, and care in prisons. As I mentioned, we know what works. We know what works in the community, and we know what works in prisons. This includes for prison systems 15 essential interventions such as HIV testing and counseling, provision of opioid agonist therapy, provision of condoms, needle and syringe programs, and overdose prevention and management. These interventions are rooted in evidence-based public health and human rights principles, principles that are still far too absent in custodial environments. Globally, only about 60 countries provide opioid agonist therapy in prison settings, and even fewer have implemented overdose prevention or needle and syringe programs in line with international standards. The gap is a public health crisis, and it is also a missed opportunity for more effective justice. Even in these 60 countries that we're talking about, the provision is minimal, it's tokenistic, and we really, in order to really have an impact on the epidemic, we really need to work with countries to scale up the interventions, to have one opioid agonist treatment available for 200 people in one prison. It just doesn't work. So it is just ticking the box, which we really need to address and make the services available to a broader number of people who need it. We also advocate for systematic reforms, reducing pretrial detention, ensuring adequate funding for prison health, and addressing the specific needs of vulnerable populations, especially women who face compounded risk and additional barriers to care. This year marks the 10th anniversary of the Nelson Mandela Rules, and the Bangkok, I think it's the 15th year of the Bangkok Rules, which uphold the principles of equivalence to care, and that people deprived of liberty must receive the same quality of healthcare as the ones in the community. Yet implementation of these standards remain limited. UNODC, we have extensive experience in supporting countries to address HIV and other health issues in prisons and other closed settings. We have been working in South Africa to strengthen coordination across justice and health institutions to ensure continuity of HIV and hepatitis care for people in custody. In Kyrgyzstan, we've worked with women in prisons to ensure gender-responsive health programs and to address trauma linked to drug use and incarceration. And in Ukraine, amid ongoing conflict, we are collaborating with civil society and correction services to maintain and expand HIV and other support services for people in and those released from prisons. However, our efforts focus not only on improving health service delivery in custodial settings, but also rethinking the role of law enforcement as a part of a broader rights-based public health response. I think the commissioner also referred to that. Police officers are often the first point of contact for people who use drugs. In 2022, nearly 7 million people came into formal contact with police for drug-related offenses, 2/3 for use or possession. However, Police respond in these interactions are either facilitate to access to life-saving services or entrench fear, stigma, and marginalization. We work to reshape law enforcement practices as enablers and not barriers to the already very limited services available for people who use drugs. This is done through training, normative guidance, policy engagement, and we are promoting what we call public health-oriented policing. For example, just last year, we trained over 600 law enforcement officials across Bangladesh, Pakistan, the Philippines, Uzbekistan, India, South Africa, and Kazakhstan to integrate evidence and human rights-based policing practices as it relates to HIV response. We have also initiated the update of our global training manual for law enforcement officials to strengthen evidence-based, health-centered policing. The revision expands guidance on rights-based approaches to HIV prevention, treatment, and care, ensuring law enforcement officers are equipped to engage effectively with all key populations, reducing stigma and supporting public health efforts. So UNODC is committed to supporting this shift, whether through technical guidance, training, or country-level partnerships. We are completely in line with the GDP report, rightly calling for fundamental shift from punishment and punitive approaches to public health partnerships and public health approaches. And we are working together with member states to build systems that uphold health, reduce harm, and promote human rights. We recognize that none of this work happens in a vacuum. What is needed now is the courage to act, the commitment to scale up, and the political will to ensure that our systems do not punish vulnerability, but protect life. I thank you all.
Thank you very much, Fariba. Our next speaker is Graham Alabaster, the head of the Geneva office of UN Habitat, and he's going to join us online.
Hello, I hope you can hear me okay, everyone. Delighted to be with you, and very many congratulations and thanks to the organisers, the Government of Switzerland and the Global Commission on Drug Policy. Excellencies, distinguished guests, ladies and gentlemen, I just wanted to take a few moments to reflect on the work of the Commission and UNODC and the urbanisation, which of course is UN Habitat's mandate, and to outline a little why this issue of drug use and how we deal with it is really of very much importance to my agency. UN Habitat has a long history of working on urban security and safety, some 3 decades of work on our Safer Cities programme, which looked, of course, at the much broader aspects of urban security and safety, and which included, of course, drug use, among other things. And a lot of this work was related to a much deeper analysis of the social systems in urban centres and understanding better the inequities in systems, in urban systems, to deal and to cope with some of the security issues. So, of course, we did do a lot of work in that time and period on managing drugs and narcotics and users. But just by way of framing this, I mean, we all know that we currently live in an urban world, and by 2050, around 70% of the world's population will live in an urban agglomeration of some kind. That's probably not news to many of you. But what's very interesting, a further statistic, is that of all the urban dwellers, of all the urban space that will exist in 2050, 60% of it is yet to be built. And this is a really important statistic because it means there's a window of opportunity for us now to bear an influence on the physical and governance aspects of that new urban space where many of those in 2050 are going to live. So coming down to the issue of the Global Commission's report, an excellent report, which we fully support and align with. Why is it so important for us? As I mentioned before, most of our work looks at the inequities in urban society. And I think, along with all of you, would agree that the most vulnerable in societies are the ones who are neglected. If we don't give priority to those communities, the risks to the more wealthy parts of cities and their productivity, their public health and other things are also seriously affected. So, I mean, from the drug perspective, there are three issues from our side. Of course, the issue of the human rights and many of the human rights abuses that go ahead of those who use drug, quite unacceptable situation in many parts of the world that we have to rise up against. The public health aspects, and particularly the lacking in social care to address these issues of drug users and support them as best we can. But perhaps an aspect of public health that's not considered is the fact that many activities, particularly things like drug-related gun crime, do pose a significant drain on already stretched public health resources at city level. To treat one non-fatal gunshot wound in a US city, we're talking about $100,000 for one case. So if you look at the implication that this has in parts of the world to the resources it takes away from public health, it's a very, very important aspect that we need to consider, and one of the reasons why we very much support the regulation of drugs and a reduction in drug-related gun crime, for example. The other thing is, of course, that our agency works mainly, we work, of course, with national governments, but our main focus is on local authorities and subnational governments. And this issue of drug use, like many others, is something which requires a multi-sectoral approach. Multi-sectoral approaches really come alive at the local level, where a mayor, the head of a city, or an appointed official has to draw on resources from all different departments in order to manage this problem. Of course, going way beyond just the crime prevention, also the public health, also the education departments and many others. So it really is an area that we need to work on. We found that many of the good case studies that have come out of some of the cities have been led by city leaders, in fact. So for us, that's very important that we support those subnational structures, that we learn from those best practices. And indeed, we've signed an MOU with the Global Commission, and these are some of the things that we're going to look at in more detail and see how we can support and share the information of this good report with many of our constituents at the city level. So in terms of what do we need to do and what will we work on together to support this issue? Of course, embodied in our new urban agenda is the idea of developing new urban policies. And of course, those have to be participatory in nature, participatory governance structures where local authorities fully engaged with the communities that they govern in order, and they work in a partnership to deliver new and novel ways of delivery of services. There's another aspect as well, which of course interests us, and that is the physical design of urban space. So on the one hand, this is about how we rehabilitate and upgrade vulnerable settlements and informal settlements, but it's also about planning the future urban space where many of these people who will live in the coming years. And that means designing housing schemes. It means designing access to facilities that encourage people to adopt healthy lifestyles and that look at some of the basic elements of safety. By the design of housing and housing setups and neighborhoods, much can be done to reduce criminality and to ensure people live in a safe environment. And then, of course, ensuring they have access to services. Sometimes in the informal sector, the communities are very ready to work and plan their informal settlements more effectively. And quite often they have find ways of making space, even in very dense communities, to provide facilities to support such issues as drug use. So just coming really to my conclusion, Habitat, in fact, next week will be, the member states will be adopting our new strategic plan, which puts access to housing and basic services back right at the centre of our mandate. And this issue, of course, is a very important part of that, about the development of sustainable urbanization and urban societies which are safe and healthy. We also hope that our biannual event, the World Urban Forum, the Global Commission organised an event last November in Cairo, which was very successful. We will also do some similar event at the World Urban Forum in 2026 in Baku, where we will take the experience, the knowledge that the Global Commission and partners have, and share that in much more depth with city leaders and provide some of the good case studies and ideas that we wish to support. So I'd like to thank you once again, the organisers, for the opportunity to join this, just to say that we are very much behind and support the conclusions of the report, and of course to address this very important issue. Urbanisation has been exacerbated, of course, by climate change, and of course the other issue of conflict. And sadly, in many parts of the world, there's conflict. In these situations, people are driven into urban space, and there's a huge impact on the ability to deliver services. So it's not an easy issue to deal with, but we do have some good lessons. Thank you very much for your attention.
Thank you very much, Graham, for these valuable remarks. The last panelist is Olivia Rope, the Executive Director of Panel Reform International. Olivia, please.
Thank you, Ambassador, and thank you to the Global Commission and Switzerland for organising this very important event that we welcome, because we need drug policy to be discussed not only at the CND but the CCPCJ. And of course, thank you to Colombia for your leadership on this very important issue. I'm really happy to be here to speak about one of the most enduring global justice challenges of our time, and that is, despite some progress, we see continued criminalization of drug use, and in our world, as wide-reaching impacts on people in prison systems, human rights protection, but also the communities that prisons operate in. They don't operate in a silo or a vacuum. And our Global Prison Trends report for 2025 that we will launch here tomorrow shows that much of the world, unfortunately, remains locked into these punitive drug policies that do not serve public health, community safety, or justice. Fariba gave all the data on the numbers, which are also outlined very clearly in the Global Commission's report. And I would just add that there are also people in administrative detention on top of these formal prison population statistics. And I think the growing number of people going to prison year on year is directly related to criminalization of drug use and possession, and also poverty, which is interlinks. And these measures are really disproportionate, they're discriminatory, and ultimately they're ineffective. We see what the Global Commission on Drug Policies report outlines, and this kind of bold and essential vision that we need for moving away from criminal justice-led approaches to drug use. This really reinforces what we see on the ground every day. Overcrowded prisons effectively mean that there are human rights violations. They inhibit it inhibits rehabilitation, which of course is the very purpose of imprisonment as set out in the UN Nelson Mandela rules. And we know that overcrowding in prisons continues, for example, in places like the Philippines, where it's over 70% of the people in prison are there for drug-related charges. In Brazil, for example, there's vague legal thresholds and judicial discretion is disproportionately impacting Black and mixed race people. In Kazakhstan, for example, there's a new law that allows life imprisonment for certain drug-related offences, and these trends are very concerning amid progress in other places. One trend that I wanted to highlight today is the link between drug enforcement and gendered criminalization. Our research published at the CSW in New York with Women Beyond Walls documented that women, particularly those in situations of economic hardship or violence, are disproportionately affected by drug laws. And in some places, up to 80% of women in prison are there for drug-related offences. And this is normally, they're not so-called kingpins or leaders, but women at the lowest rungs of the drug trade or for drug use, often coerced into transport or selling to survive, criminalized for their drug dependence, or imprisoned because of their partner's activities while bearing the full brunt of the law. And many are primary carers of young children. Their imprisonment has a profound intergenerational impact, and this is rarely acknowledged in sentencing or detention policies. We found that women in vulnerable situations, such as those working in informal economies or people displaced or survivors of violence, are punished for actions taken to survive. This is not justice. This is the institutionalization of inequality through criminal law. And this brings me to another issue that we wanted to bring to the table today, which is one of the most severe consequences of punitive drug policy, and that's the use of the death penalty for drug offences. At least 34 jurisdictions retain the death penalty for drug crimes, and in 2024 alone, nearly 40% of all known global executions were carried out for drug offences, which is an increase of nearly 2,000% since 2020, as reported by Harm Reduction International. In some cases, these executions involve foreign nationals, people with mental health conditions, and in many cases, for people who were denied a fair trial. The death penalty, particularly for drug offences, violates the most basic principle that capital punishment should only apply, if it does, to the most serious crimes, a threshold that drug offences does not meet under international law. Colleagues, we see from the data, it's clear, criminalising drug use and small-scale supply does not reduce crime, it does not reduce harm. It breaks apart families, overburdens justice systems, and fills prisons with people who are who are the least able to access fair legal and human rights protections. Positively, more than 66 jurisdictions have now adopted some form of decriminalisation, and this is certainly a promising trend. And this decriminalisation must be implemented in ways that are meaningful and sustainable and grounded in the evidence that we have, the wealth of evidence that we have, and on public health and the impacts for human rights. So we also call on for decriminalisation of personal drug use and possession alongside all of our partners. And we also call for the review and repeal of laws that disproportionately impact vulnerable groups such as women, abolish the death penalty for drug-related offences urgently, and we would add to this to meaningfully include people with lived experience of imprisonment and drug use in policy reform to ensure that the reforms are effective and grounded in lived realities. I will conclude there as I know time is tight, but we look forward to continuing our discussion and dialogue on this issue. Thank you.
Thank you, Olivia. I think we have time for 1 or 2 questions. If anybody, sorry? No, for the closing, yes, but before we have some questions, I think, or not? Yes, please, if you can give us your name.
Good afternoon. My name is Vera Tkachenko. I work in UNODC in the Crime Prevention and Criminal Justice section, focusing on penal and prison reform. And as it was mentioned, again, globally, a lot of people are serving sentence for drug-related crimes, right? And many of them are non-violent crimes. But my question is actually about building the public demand, right? We all know about these policies of zero tolerance on crime or zero tolerance on drugs, which actually fill up prisons. And if there is no proper reintegration and rehabilitation, it becomes a vicious circle. People come to prison, serve sentence, go out, and then come back again to prisons. So the question is how to build this public demand so that politicians take a more friendly approach to the drug prevention and drug treatment, rather than using this very harsh on crime and harsh on drugs approach. If you could.
I'll just make one comment, and perhaps some others in the panel will comment as well. And that is that in the pursuit of change in this area of public policy, you can never take for granted the support that you need. You must keep working all the time by linking up what you're saying and doing with ordinary people and their day-to-day concerns. Otherwise, this will be seen as a sort of abstract issue up there done by certain people, but not affecting us. So at each stage of the process of change, I think you have to be assured of the fact that you've done the work with the people, so that when the crunch comes in the parliament, I'm giving a very parliamentary political answer to your question, having spent 20 years of my life in the business, with that constant link, you'll find it much easier to get support from the wider community. And I think that's a lesson that a lot of reformers forget. They might have a temporary majority, but there's other factors at work, so that when it gets voted on, it's no longer a majority. Keep the people with you every step of the way. Frame the argument as a people's issue, and it is a people's issue. Police harassment at music festivals, or all sorts of aspects of the criminalisation of drug use that cause difficulties for ordinary people. Did you want to add?
Thank you. I suppose I would just add that, and I did say that in my intervention, that there's just a wealth of evidence out there. So it's making sure that that is relayed to the public in a clear, effective way. And there's a lot of examples now to draw on to show what the alternative can be. And I think we need to do that better also as an international community. So as you say, the people, the general public are convinced of the alternative approach that does work and is being implemented in many places, actually.
I'll just add one little anecdote. The American President, Lyndon B. Johnson, you would always recall, I'm sure, that he was a very important reformer when it came to civil rights. He was approached by the feminist movement, which was developing very strongly, that women need to be given the recognition that we've given to others. And he turned to the people who were giving advocacy to him, the women, and he said, "I want you to make me do it. Make me do it." So not doing it would be a bigger problem than doing it. And I think that's good political advice.
Okay, the last word comes from Laura Chill with the conclusion. But before I give her the microphone, I just want to announce that the meeting will not end here. After the meeting, you are invited to have a light lunch, which will be served outside. So if you have time to join us for a bite and to continue discussions about after that, you are very much welcome. With that, please, Laura.
Thank you, Rafael. Thank you, Ambassador. This is my last side event. Yeah, sadly, this is my last side event. So I would like to begin by saying that Colombia's commitment to a more people-centered, more human rights aligned, more defensive of public health global drugs policy is strong, will remain long after I'm gone. So you can count on Colombia. And as for my personal conviction, I have to say that everything I did here, everything I said, I believed. And that will not change with my post. So you have a defender for a change of this global drug policy that has failed decade after decade. You'll have it somewhere else, but I'll be there and I'll be still defending change. In another position, I will not be able to be this outspoken, but I will make sure that I will facilitate the conversations that we need to have. So having said this, this is what I have to say about this wonderful panel. Thank you to the people around this table. Thank you, because you were there to build alliances when we needed them. All of you, civil society, Switzerland, of course, UNODC and the Global Commission. So, today's lunch is for us more than a simple presentation. It is an invitation to act, an invitation to rethink, reform, and reject the failed logic of punishment that for too long has shaped drug policy. It exposes how criminalization has disproportionately targeted marginalized populations, how coercive treatment practices violate rights, and how policies based on fear rather than facts have failed to reduce harm. And as I said at the 67th session of the Commission on Narcotic Drugs, Colombia knows these failures intimately. For decades, we were the center of a war on drugs imposed from the outside. We lost lives and we lost time. For decades, punitive approaches have filled our prisons, destroyed lives, and destabilized communities, often without achieving the intended goal of reducing drug use or trafficking. But Colombia has chosen to change course. And I'd like to brief you. I'd like to highlight very briefly about the recent adoption of Law 2292 of 2023, also known as the Public Utility Law. So, drug policies have historically had a disproportionate impact on women, particularly those from the most vulnerable situations. And by providing an alternative to incarceration for women who are heads of household and have committed offenses under conditions of marginalization, the law acknowledges and seeks to mitigate the challenges faced by women within the criminal justice system. And it represents a tangible effort to incorporate gender perspectives into drug policies, ensuring that justice does not come at the cost of deepening existing inequities. By prioritizing restorative justice over punitive approaches, it fosters a system that values reintegration over exclusion, enabling women to serve their sentences through community services rather than incarceration, allows them to maintain their livelihoods, support their families, and continue their education, ultimately reducing reoffending. These women instead of serving prison sentences, can contribute to society through public utility services, reinforcing their role as caregivers while promoting social reintegration. And the model and the law, we hope, is a model to inspire others. It reflects what the report advocates: policies based on evidence, rights, and compassion, not fear, stigma, and control. We will not reduce violence, incarceration, or suffering through repression. We will do so by investing in people, not in prisons. And let me close by thanking the Global Commission once again. We were especially moved by the report's emphasis on alternatives and what a different future can look like when harm reduction is prioritized, where people who use drugs are supported, not punished, where states regulate markets in ways that protect health and reduce the power of organized crime. Let us leave this room with a renewed sense of purpose to move beyond punishment and toward dignity, equity, and justice. Thank you.